Hi, everyone. Welcome back to another episode of the Slimming Surgeon podcast. I'm your host, Dr. Kandace Kickler. Today, I'm interviewing Dr. Aneesh Gupta. He is a quadruple board certified cosmetic surgeon who provides a full range of cosmetic and aesthetic treatments for the face and body. He is certified by the American Board of Cosmetic Surgery and the American Board of Facial Cosmetic Surgery, the two professional associations representing the specialty of cosmetic surgery, which is my specialty. Dr. Gupta earned degrees from Georgetown University, the University of Pennsylvania, and UCLA. He completed his cosmetic surgery fellowship in Nashville, Tennessee, training under renowned surgeon Dr. Jeffrey Marble. A significant portion of Dr. Gupta's practice is dedicated to caring for transgender patients. He and the team at Shiloh Cosmetics are proud to offer the highest level of care in a supportive and welcoming environment. Dr. Gupta specializes in double mastectomy chest masculinization using the free-nipple graft technique, as well as fat transfer to the breast. He is also committed to achieving gender-affirming surgery through ongoing research. His recent article, Mastectomy Surgical Recommendations for Female-to-Male Transgender Patients, and a discussion of gender-affirming care for gender dysphoric adolescents, was published in the American Journal of Cosmetic Surgery. So I'm very excited to welcome him today and have an open discussion about his techniques, the options, and all things cosmetic surgery. So I will be welcoming Dr. Gupta now. Welcome, Dr. Gupta.
Thanks for having me, Dr. Candace. Appreciate your time.
Of course, I'm super excited. So I'm just going to get right into it. You highlight both cosmetic surgery and gender affirming top surgery in your practice. Can you kind of define what top surgery is and discuss what led you to start incorporating that in your practice?
Sure. So top surgery is really just a generic phrase that refers to any sort of procedure involving the chest or breasts as part of gender affirming care. It's kind of like mommy makeover. It just means it's a generic catchphrase that just means we will do some variety of procedures to help the patients achieve their desired body. I really started doing this in fellowship where I was trained by Dr. Marvel, who's fantastic. He was a great teacher, great surgeon, and he was doing a lot of these top surgeries in Tennessee. He was one of the only people at that time in Tennessee doing them. And I learned how to do the procedure the way I do it from him. Really fortunate to have trained under him for a year in Nashville.
That's really incredible. Yeah, it's hard to find a provider who provides this type of care. Have you noticed, like, is there more interest or is it more accepted in the area where you live now versus where you trained?
Well, I'm in Philadelphia right now, and Tennessee's a fairly red state. Pennsylvania's kind of purplish, but in Philadelphia and Pittsburgh, it's definitely a very common, very accepted procedure. It was actually fairly accepted in Nashville as well, but Tennessee has different views on trans care, so it was a little bit less advertised than it is in more northern cities like where I am now. So very, very fortunate to be in an area where it's accepted and there's a lot of patients.
Absolutely. And what about insurance coverage? Is that available where you are or in certain areas?
It is. Insurance will cover this procedure from time to time. I was taking insurance before, and then unfortunately I had to stop because I'm sure you know dealing with insurance companies is very difficult and they don't pay providers for 6 to 12 months after the procedure. And as a small business owner, it just wasn't sustainable from a financial perspective, unfortunately. But we do
Yeah.
partner with third-party financial providers, which does help make it more affordable for patients.
Yeah, no, I can completely relate. When I was doing general and bariatric surgery as my career before I switched to cosmetic surgery, it was like the labor involved from your staff to get a payment for a procedure that you already did. It's like really, really crazy. So, it's good that you have options for people. And I love how you also kind of have other options as far as your informed consent model. So for your gender affirming top surgery, you've got the informed consent model. You don't have a BMI limit. Tell us your thoughts on this.
Sure. So it used to be standard of care that everyone needed a letter from their therapist or psychiatrist to say that they were okay to undergo this procedure. But what we found is that It was basically just a barrier to care for these patients. And I treat these patients just like any other cosmetic surgery patients. If they're above the age of 18 and they can demonstrate that they understand what I'm telling them, if they ask good questions, if they can understand the risks, the benefits, the alternatives, as long as they know what the procedure entails, it's their body, their choice. And I'm just here to act as a means by which they can achieve that. So some providers do require the letter still, but I found that it really didn't provide any benefit. I think a lot of providers that were requiring the letter did so because they were afraid of the risk of regret, which is something that's cited frequently with patients undergoing gender affirming care. You'll statistically, from the studies that have been done, the risk of regret is only about 1% in these patients, which is incredible. I mean, it's extremely rare. Just as a means of comparison, patients undergoing hip surgery have about a 20% risk of regret. So, and that's something that's never discussed with those patients, right? So the risk of regret is not something that we focus on too much. And we try to make sure that, patients understand what they're getting into, which is the most important thing. In terms of BMI, top surgery is a skin only procedure, right? We're not repairing any muscles, anything like that. And as long as anesthesia is okay from a safety perspective with the patient's BMI, I can operate on someone with almost any BMI. I've done patients, in the 45, 50 BMI range before, and they had really good results, right? And it's as long as anesthesia thinks that they're going to be safe, I'm happy to do a bigger procedure. We extend the excision a little bit, the incision a little bit more. May remove a little bit more tissue than a smaller patient, but just with some small adjustments, you can help these patients achieve a really nice outcome.
Sure. I mean, I can relate with because I do so much lipo and I do a lot of awake lipo.
Yep,
We often get asked about a BMI limit. And I'm like, well, we're doing this awake. Like, your main risk with that is, the anesthesia component. And if we're doing the
exactly.
procedure awake, sticking to the legal limits of how much we can remove fat wise, it's a very safe procedure and the BMI doesn't really matter. Obviously, diabetic, other things like that we have to take into consideration, but a healthy high BMI patient can absolutely have cosmetic procedures without, fear of it not working or having a really bad outcome.
And we do things to, high BMI in and of itself can have some risk, but we do things to make sure that we're minimizing that risk. We'll do pre-op EKGs, labs, clearance forms. So there are still steps that we take for any patient, but those will help reduce the risk for all patients that we see.
Absolutely. So, my audience may not know, and I don't fully know because I don't provide gender affirming surgical care with what I specifically do, but I know there are different approaches for like the female to male top surgery and even the male to female, perhaps. So, could you kind of share with us like how that decision making goes and like what the different options are?
Sure. For patients that are transmasculine, female to male, I do the double incision mastectomy with a free nipple graft, which is basically an incision under each breast that extends to the lateral chest. And then, depending on whether the patient wants the nipple graft, we'll do that at the end of the case. That's the standard procedure. You can do that for patients of all sizes. Now, for patients with smaller chests, there are surgeons that do other approaches. You can do the periareolar, you can do the keyhole approach. There's some surgeons now that will attempt to do nerve preservation. So definitely some innovations being introduced into this field, which is really exciting. And for the trans feminine patients who are male to female, the standard of care for a while was implants, either above or below the muscle, depending on the chest that they start with. But what I'm finding now, and which is becoming increasingly popular, is a fat transfer to the breast. And, patients like it for a variety of reasons, right? There's no foreign objects in the body, lasts the rest of your life, right? Implants you have to exchange every 15 to 20 years roughly. It's a very natural fullness. And, I go over the different options with patients. I give them the full spectrum of what the different procedures are. And then I'll tell them, I do these procedures. I would recommend these procedures. And if our goals are not aligned, I'm happy to tell a patient, there are other providers that do a great job that have a different approach. And I encourage them to seek out second opinions, other surgeons, because when a surgeon comes to me, I want them to be confident that they're choosing the right surgeon for themselves. So it's a lot of options for these patients, which is really exciting.
Yeah, no, that's great. With the fat transfer to the breast or to the chest, it's also kind of like a added bonus that they're going to get liposuction of another area, right?
Absolutely. Yeah, that's a big add-on for these patients, right? You get a more contoured abdomen in addition to larger breasts, which gives you a more feminine shape in and of itself. So it's really like a 2-for-1
Like a two for
procedure.
one. Exactly.
Yep, 100%.
What is your experience with, like, the percentage of fat that takes? Does it differ if it's someone who's, trans feminine or a regular or a cis female? Like, what is your experience with the amount of fat that takes?
Yeah, great question. I tell patients on average, for anyone, 60 to 70% of the fat should be retained. It's a bell curve, right? Some are going to be 40, 50, some are going to be 80 to 90% retention. I have not found a difference between cis female patients and trans female patients. I find that the amount of fat that's retained is really dependent on the patient's genetics, nutrition, some things that we really can't control. But I try to give them as much fullness as I can. I'm very honest with them. I tell them you may retain a lot of the fat, and that's great. You may need a second fat transfer if you really want a lot of volume in the future, which is something that can be done. But of course, involves a second procedure and costs and things like that.
Right. Okay. That's really interesting. And what about barriers? So, what barriers are you seeing? Is it mostly financial, social? Like, are there many medical barriers that you're seeing with your patients?
These patients have many, many more barriers than your average cosmetic surgery patient. Medical, no. I think in general, they're young, they're healthy. They have seen providers very frequently for hormone replacement therapy, things like that. So, in general, if they do have a medical issue, it's pretty well controlled. But, they struggle financially. They may not have a lot of social support. Unfortunately, a lot of patients don't have siblings or parents that are supportive of their transition. And it's really sad to see because they're just like any other patient. They want to look at their body, feel comfortable, and have an external body that matches their internal feelings, right? And for them to not have the support preoperatively, postoperatively, it's really disheartening. And, I wish more people were accepting of patients making their own medical decisions.
Absolutely. Yeah. You have a lot of compassion, which is why I'm sure many of these patients choose you to be their surgeon. What other things are you offering or recommending for your patients? And it doesn't necessarily have to be, your patients who are transitioning, but are there things that you are loving lately to recommend or doing in conjunction with some of these procedures?
Sure. I think that there's a couple things that I really love right now. So number one is the easy answer is AI. I'm using AI when I do my social media posts, it just gives you a little bit more of an advantage to see the transition that AI can achieve with these videos, which is fantastic. And of course, we're just beginning to see how AI can be incorporated into our practice.
Are you using like an app for this or how are you using AI?
I am using something called Higgsfield, which is I have no financial interest in the company. It's just an app that I use.
Okay.
I highly recommend it. I learned about it from a very well-known plastic surgeon in Utah, Dr. Chittister, and he did a tutorial about how he uses it on Instagram, and I followed his tutorial and just used it for my own social media posts, and it's been really exciting to use that. Highly
Nice.
recommend it. It's a really good app. I'm really looking to getting into Alaclay, which is
Yeah.
the donor fat transfer. You get a lot of skinny patients who just they don't have a lot of fat to transfer. And this is a really good option. And from what they're reporting, their retention rates are 80 to 90%, which is even higher than natural fat transfer.
Yeah, I've heard the same
Have you used it yet?
I've used it,
Okay.
but the jury's still out because I just used it, so I
Okay.
can't quote the retention rate for my experience yet, but I can say it truly felt like I was injecting fat.
Wow.
Like
That's
some of the
great.
fillers and things, they just have a different flow rate and a different consistency to them, but this was fat and it felt like fat and it injected like fat. So that was really cool to experience. But they are, a hot commodity. I can't
Definitely.
get it until next year at this point.
Yeah. It's
So
yeah, they're back ordered. It does come with a cost.
yeah,
For the right patient, it's a
a really
new
good
option and it's pretty exciting. Yeah.
I totally agree, I
Um
totally agree.
I also like that I think we're always increasing safety and through research and trials in cosmetic surgery. So for the big one was we introduced the use of ultrasound during BBLs, and that has really improved patient outcomes. So I think just things like that are making it exciting for patients and making it safer, especially in the United States.
Exactly.
And then there was
Wonderful.
There's one more thing. Oh, and then I know you do this as well, but something that I love doing and I think is another great option for patients, which is becoming more popular, is awake liposuction.
Yes. Oh my
You can
gosh.
do I can liposuction a patient's whole body with them fully awake, and there's no risk of anesthesia. They get up off the table, they go home after 15, 20 minutes. There's no side effects of anesthesia. They're not groggy. They go home, they're walking around. Extremely safe, great results, and I think that's gonna become more popular in the next few years.
It has been life-changing for me, like, truly. Not only is it most of my practice at this point, I mean, my surgical practice, obviously, I'm still doing many general anesthesia cases for things that you need it for, or patients who adamantly, refuse to do something awake. They want that comfort of not being awake. It's just incredible how you can transform so many people's lives. How many people are fearful of anesthesia?
Absolutely. Yeah.
We hear it, they mention it to us, but truly, when you give the option of, "Oh, we can do it, like, with you just slightly sedated," like a Xanax, like you're a couple cocktails in, so many more people are open to the idea and excited to transform their body knowing it's much safer.
Mhm.
And it's not only safer because of that lack of anesthesia risk, but I talk to my patients, like the chance that another organ is going to be injured is
Mhm.
almost zero
Yeah.
because you're awake. Like I can't penetrate your abdomen when you're awake. When you're under general anesthesia and you're paralyzed, that's a higher likelihood. It's still not likely, but it's, an actual risk. So, and then, not being paralyzed, you're not having the blood clotting, the pneumonia, like all the things that come with that risk. So, I have a lot of people that are much more open to the idea, and we get to do a lot of nice transformations for them because of this.
That's great. Yeah, I think the number one thing when I do awake lipo, the number one thing that patients say is, anesthesia is super safe. We have great providers. They're just afraid of being put to sleep or they don't want to be put to sleep. And this is a great alternative that patients have access to.
Absolutely. And I even feel like you can almost do a better job in some situations. For example, like the waistline, because I'll have my patients be lying flat supine. I'll have them be on their side, but I'll have them like
Yeah, they
rotate.
can maneuver during the case. I
Yeah.
love
And
absolutely,
that
yeah.
way it's like I make sure I get every little bit. And that's not as easy when you're dependent upon, your assistant to hold the body a certain position or what have you. So yeah, no, it's been amazing. And I actually had it done myself too and operated the next day. Like that's how
How was it for you?
it was great. It was
Yeah?
fabulous. I had no pain, like 0.
That's
So,
amazing.
when I tell people, like, "I'm just gonna send you home with ibuprofen," they look at me kinda crazy sometimes. I'm like, "No, listen, I did it myself. You're gonna be fine. If you need something more, I'll give it to you, but you're not going to."
Yeah. I think in the last 3 months, I've probably done, 60 awake lipo cases.
Yeah.
I've had one patient need more than Motrin and Tylenol post-op
Yeah.
for discomfort.
It's
It's
amazing. It's
the pain
amazing.
is really well tolerated.
I love it. Well, Dr. Gupta, this has been a fabulous conversation. I wanna, open it up for another minute or 2. If you have anything else you wanna share, any other topics that you wanna hit, anything like that?
Yeah, I think something that we can do better as a cosmetic industry is have more representation. And I think that, the public has this perception that who goes in to get these surgeries, right? Or who ends up getting these surgeries? Someone with a lot of money who's really skinny and they end up looking like, a Sports Illustrated model at the end. But the
Yeah.
reality is that more than 90% of patients getting these procedures just want a little touch up. They just want a slight improvement. They just want to be a little bit happier with what they see in the mirror. And I find that the trans population has almost no representation in social media within the cosmetic surgery industry. And I've even heard from other surgeons that even if they do these procedures, maybe they're not advertising or maybe they're not
Yeah.
putting them on social media because they're afraid of the backlash from other patients or the community. And I think that's doing a disservice to these patients that deserve the same kind of care that everyone else is getting. And then I think something else that I've tried to do is keep my prices really affordable. I know
Mhm.
that there's surgeons out there charging $200,000 for a facelift, right? Which is crazy. And
Mhm.
if they charge it and patients can come in and they can afford it, that's great. But I try to keep my prices within a range that make it accessible for most patients to have the procedure done. So I think that, cost is definitely a factor that can impact patients. And I want as many patients as possible to have the results they desire.
Yeah, that's wonderful. I mean, I can echo your sentiments, completely. someone who would look at me would say like, Why did you need lipo? You didn't need lipo." Well, there was a couple spots that bothered me since I had a baby, like it's okay to want to make adjustments to yourself.
Sure.
And we should be speaking about that. We should be talking about that. We should be giving our experience. And similarly to the discussion about the cost, it just, I don't know, it gives me like red flag vibes when people charge that much because it's not normal. It's not realistic. And it's like, what are you doing that I don't know. I'm not going to say too much about it, but I will say I called a surgeon locally here that is known for doing like a great job with like face and eyes. Like it's a facial plastic surgeon because I want to have a quote done for my eyes. My assistant called for me and I was able to get an appointment for August of 2027.
Wow.
We're in 2025 still. Like, are you serious right now? To me, that's like, okay, either he's like incredibly slow in the operating room, so he only has 1 or 2 days where he operates and takes a really long time for every single case, or like he takes a lot of vacation. Like, I have no idea, but that doesn't make any sense. Like, I'm very busy, but I can see a consult next month,
Yeah.
like wild.
Same. Yeah.
So, yeah, I don't know. I think there's got to be something funny with those situations. So, but to each their own.
Yeah. I mean, I've seen these surgeons that charge a lot of money, and
Yeah.
the results are incredible, and
Yes.
patients want to go to someone specific, and they're willing to pay.
Yeah.
That's capitalism.
It's capitalism. Anyways, well, thank you again so much, Dr. Gupta. Where can people find you? We're going to have a lot of listeners who are maybe interested in some of your care and we can blast this out. So, where can you be found? Your best social or your best other method of communication?
Yeah, absolutely. Patients can see my website, which is shilohcosmetics.com, SHILOH cosmetics.com, or through Instagram at Philly Cosmetic Doc, Philly PHILLY. And
Love
I'm
it.
always available with patients that have questions or they want to reach out. Happy to chat with them.
Amazing. Again, thank you so, so much. And everyone, if you're listening, make sure you follow Dr. Gupta. And we will, in the show notes, have links to his social and his website. That way you guys can contact him and we will let you go. Have a great day.
Thank you so much for having me. I appreciate your time today.
Of course. Thank you. Okay.